go.
You
Drink.
playing with the water?
Drink. Take a drink.
There you go, buddy. You ready to go upstairs? Let's go. It's your big day.
Good job.
You know what to expect? He has no idea. Found one of those doctor's office waiting toys. So we're at the Timpanogos Assessment and Psychological Services Center. I believe that's what it's called. I'll post a little thing here. Screenshot. Everybody, so we can't actually show you the process, the ADOS 2 process. There's legal reasons for that. I don't know what those are, but there's legal reasons. So we're gonna have Dr. Teresa explain just a little bit about when you should get your child in for a diagnosis and some other important factors. And I better go find Alistair. I know a lot of you guys are chomping at the bit to know the diagnosis. We are too, and they will send that in a packet in the mail in a couple of weeks. So we will be sure to put up a video as soon as that happens. In the meantime, from what I understand, you can go on through. She just said what we've heard from other professionals, which is there's a lot of concern that he is on the spectrum, and but it's good that we're getting help and getting early intervention. That's the key. So, yeah, we'll let you listen to a message from her, and you've seen a couple of pictures here of Alistair inside. We were allowed to take pictures, but that's it. And yeah.
Okay,
right.
So my name's Dr. Teresa Cardon, and I am a speech-language pathologist and a behavior analyst, and I'm the director of the Melissa Nelson Center for Autism at Utah Valley University. So they were asking me to tell you a little bit about what I think is important in terms of diagnosis and kind of when diagnosis needs to happen. The earlier the better. So that's kind of hard because a lot of pediatricians and early interventionists get a little wary of labeling a child, and yet if you're seeing red flags, if you're seeing a lack of eye contact or a lack of pointing and a lot of sensory things that are overwhelming, or a lot of signs that there are some different sensory preferences, limited eye contact, I think I said that one, very limited language or different language, a lot of scripting, a lot of movies, a lot of echoing, those are some of the red flags. And if you're seeing those things, pop. Get in there and ask some questions, and getting a diagnosis can actually help you get the services that you need. In fact, we were just talking about services in Utah have changed a lot in the last couple of years because we have Medicaid available for kids on the spectrum now, and insurance, and there's just a lot more options and opportunity. So a diagnosis is overwhelming and hard and not a good day usually. It's usually a really hard day, but it tells us where they're at and how we can proceed to move forward to support them. And that's the key.
Awesome. Thank you so much.
You're welcome.